Just and CAM.
So our first topic is comfort. Comfort means a state of physical ease and freedom from pain or constraints. Make a patient feel relaxed and supported in their environment. The pain means it is a physical state. The patient got the freedom from the pain and constraints and make the patient feel and relaxed in their environment. It is means comfort. Then the factors influencing comfort. The first one is physical comfort. Physical comfort means proper positioning, suitable bedding and use of supportive devices to reduce strain or pressure. Physical comfort means we are providing the proper positioning and suitable bedding and supportive devices to the patient. Next one is psychological comfort. Psychological comfort means creating a reassuring atmosphere and eases anxiety and promote a sense of safety. In psychological comfort means we are providing a psychological support to the patients. The next one is environmental comfort. Adjusting factors like temperature, lighting and noise to suit the patient's needs. According to the patient's needs, we are providing the the need of temperature, lighting and reduces the noise. It is means environmental comfort. Then therapeutic interventions. It means using specific beds, cushions or positioning techniques to prevent discomfort or complications. These are the factors influencing comfort.
So next which is come under types of beds in hospital. So it just comes closed bed. So closed bed means it is prepared for a new patient admission. So whenever the patient is coming, so we are preparing for that patient, that is closed bed. So next is open bed, that is ready for immediate patient use. So when the patient is admitted to the hospital, so after that we are making the bed, so that is open bed. So next is occupied bed, that is made when the patient cannot get out of the bed. That is sometimes it is ambulatory patients or the patient is after the surgery, so the patient can't move by themselves. So it is come under occupied bed. Next is post-operative bed, that is after the surgery patient will be in the bed. So prepared to receive the patient after surgery. So we will be preparing the bed after the surgery. So that is post-operative bed. Next is Fowler's bed, that helps in breathing the breathing problem. So we will make the patient in Fowler's position. So it will help the patient to breathe easily. So that is Fowler's bed. And next is cardiac bed, used for heart patients. And next is air or water bed. This is usually used for prevent the bed sore or bed ulcers. So it will be using for the some patients they can't move. So in old age patients or the after surgery patients or some high critical conditions of the patient. So in such cases, in patients we are using this air or water bed. Yeah.
The next is purposes of bed making. First one, to provide comfort and relaxation. For providing the comfort and relaxation to the patients, we are making the bed. Next one is to prevent pressure sores. To relieve the pressure sores or bed sores, we are making the bed for the patients. The third one is to maintain hygiene and cleanliness. Next one, to promote proper body alignment, to providing the proper body alignment to the patients. Next one, to reduce the spread of infection. To prevent the spread of infection, we are providing the proper bed making to the patient. These are the purposes of bed making.
So next we are moving to the therapeutic positions. So therapeutic positions, it will come like Fowler's position, supine position, prone positions, lateral positions, so many positions it will come. So first is Fowler's position. So we already discussed Fowler's position helps in breathing and eating. So we will be sitting like in Fowler's position like 45 degree. So it will helps in, it will be in 90 degree. So it will help in breathing. So next is supine position. So used for the examination and rest if there is any procedure or something like that. So we will be using the supine position. Next is prone position, that will be like improve the oxygenation in some cases. Next one is lateral position. So it will be prevent the pressure source. In lateral position, we'll be changing the positions of the patient to one side to another side. So it will be helps in to prevent the pressure sore. Next is Sims position. So this is Sims positions we are using when we are giving the enemas or rectal procedures. Usually we are using this Sims position. So it will help to, if any enemas we are giving or any suppositories we are giving, we will be using the Sims position. Next is knee chest position. So that will be like used for rectal examination itself. And next is lithotomy. So if any gynecological examination or vaginal examination or the delivery time, we'll be using this lithotomy position.
Next one is comfort devices. The comfort devices are pillows, backrest, footboard, bed carder. These are the comfort devices. Pillows are used for support the back and the head of the patient. Next one is backrest. It is used for help the patient sit comfortably. For comfortable sitting of the patients, we are using the backrest. Next one is footboard. Prevent the foot drops. Next one is bed cradles. Keeps bed sheets away from the body. Air cushions to prevent pressure sores. To relieve the pressure sores or remove the bed sores of the patient, we are using the air cushions. Next one is sandbags. Provide support and stability. For providing the support and stability to the patient, we are using the sandbags. These devices helps to maintain proper body alignment and prevent deformities. To prevent the deformities and providing the proper body alignment to the patients, we are using the comfort devices.
So next we are moving to the next topic, so that is rest and sleep. So we know that rest is very important, like relaxation. It will be providing relaxation to our body. So rest is a state of relaxation without the activity. And next is sleep. Sleep is a natural temporary loss of consciousness. So this both the rest and sleep is very important whenever it's for healing or recovery. So this sleep and rest is very important. So we know that if we are having any problems or anything like related to any conditions or any diagnosis, so the doctors, they will mainly focus on the rest and sleep. They will tell us like you have to take the proper rest, you have to take the proper sleep. So the rest and sleep is very important. So both is very necessary for the healing and recovery.
The next topic is physiology of sleep. There are two main stages in the sleep. First one is NREM sleep and next one is REM. NREM means non-rapid eye movement sleep and REM means rapid eye movement sleep. The NREM is light to deep sleep is considered as the NREM sleep. It is for body temperature and heart rate decreasing the heart rate and reducing the body temperature. We are providing the NREM sleep. Next one is body repairs tissues during deep sleep. Whenever we take the deep sleep, that time the tissues are repairs. Next one is REM sleep, dreaming stage of the sleep. This stage is the dreaming sleep of this stage is considered as the REM sleep. Next one is brain activity increases. In this type of sleep, the brain activity will increases. Important for memory and learning. For the memory and learning, important for the memory and learning, REM sleep is very useful.
So next we are moving to the functions of sleep and factors affecting the sleep. So functions of sleep, it will come, what are the functions it will help when we are sleeping. So first is restore the energy. It will boost the energy when we are sleeping. So next is repair the body tissues. So it will be repairing the body tissues, improve memory, because for the exams and all we will get that knowledge like you have to sleep more before writing the exam. So it will be improve the memory. So it will help the sleep function. Next is strengthen the immune system. So if we are having any disease or any conditions like any fever or anything, cough or cold, they will tell like you have to take proper sleep. So it will help or the strengthen the immune system. So these are the main functions of when we are getting sleep. So it will restore the energy, repair the body tissues, improve memory and strengthen the immune system. Next one is factors affecting the sleep. So when we are not getting the proper sleep, what all the factors it will affect? So it will be pain and illness, disturb sleep. So it will be getting an anxiety and stress, reduce sleep quality. So if you are not sleeping properly, we will be getting the anxiety and stress. So next one is noise and light. So when we are getting this noise or light from outside, it will be interrupting the sleep. So these are the factors. And next one is medications. So due to some medications, it will cause some drowsiness or insomnia. Insomnia means we will be not able to sleep properly. So these are the things which will be affecting. And next one is age affect the sleep pattern. So for some children, it will be affecting the sleep pattern, it will affect. So these are the main factors when it will be affecting when we are not getting proper sleep. So pain, due to the pain and illness it will be affect the sleep, and due to the anxiety and stress it will affect, and due to some noise, some outside noise or some any of the noise it will affect the sleep. Next is medication. Due to some side effect of the medications we can't get proper sleep, but some medication it will be providing oversleep to us, and some medication it will not be providing proper sleep to us. And next one is age affect the sleep pattern. So these are the factors which affecting the sleep.
Next one is promoting rest and sleep. First one, providing comfortable bed and environment. For the better sleep and better rest, we are providing the comfortable bed and clean environment to the patient. Reduces noise and dim lights. Reduces the noise, the external noises we are reducing, and avoiding the dim lights from the patient's room. Next one is give warm bath or back massage. For the proper rest and sleep, we are providing some warm bath and back massage to the patient for the better sleep. Next one is encourage relaxation exercise. We are providing the relaxation exercise and encourage the patient to do the exercise. Next one is avoid caffeines before bedtime. Before the bedtime, advise the patient to avoid the caffeines before the bedtime. Next one is administer sleeping pills if prescribed. If the doctor or physician is prescribed any sleeping pills to the patients, we are administer to the patient at the correct time.
So next one is managing pain and physiology of pain. So how you will be managing the pain? Pain is an unpleasant feeling. So it is a warning sign of injury or illness. Meaning of pain, and it is subjective and differs from person to person. So this is the meaning of pain. So what is pain means? It is unpleasant feeling, because if we are getting pain then we will not be pleasant. So that is mean by unpleasant feeling. So we'll be having disturbed by the pain, sometimes will not be getting proper sleep, a proper rest by pain. So these all are the pain, the side effect of pain, and it is a warning sign of injury or illness. Sometimes it may lead to the injury or illness. And it is a subjective and differ from person to person. So if two person is getting pain, so both the persons are differ from person to person. I am having pain and she is also having pain, so the intensity it will vary from person to person. So it will be differ from person to person. And next is physiology of pain. Physiology of pain, it will come under like pain process include 4 steps: transcription, transmission, perception and modulation. So these are the 4 steps which comes in under the physiology of pain. So transcription means injury activate pain receptor. So when we are getting the pain, so it will be activating. So next one is transmission. So that signal it provides signals to the spinal cord. So I will give an example for this. So when we are touching to a hot object, first what we will be doing is, first we will be getting that sensation of the pain. So suddenly we will remove our hand from this. So that is that signal we are providing. And after that we will getting that pain, and last we will recognize that pain and we will be try to reduce that pain. So that it comes under this transduction, transmission, that pain signal it will get, and perception we will recognize the pain, and that is last is modulation. Modulation means we will try to reduce the pain. So these are the physiology of pain. So you can get take some example of that, and you can get more idea for this physiology process.
Next one is common causes for the injury. What are the causes of the pain? First one is injury or trauma. If we are getting any injury or if we have any trauma, it will lead to the pain. Next one is surgery, and the infections is also the causes of the pain. Next one is inflammation and cancer and muscle spasms. These are the common causes that affect the pain. These are the causes of the pain. Next one is types of pain. Types of pain are 5 types. First one is acute pain. Acute pain means it occurs and suddenly it will occur and occurs in a short duration of the time. Next one is chronic pain. It occurs in a long duration and long lasting pain. Next one, nociceptive pains due to tissue damage. Because of the tissue damage, the nociceptive pain will be occurring. Next one, neuropathic pain means due to nerve damage. If we have any nerve damages, because of that the neuropathic pain will be occurring. Next one, referred pain felt in another area of the pain of the body. These are referred pain. These are the 5 types of pain. This will ask for the 2 mark questions for your exams.
Next one is pain assessment and pain scale. So pain assessment, like what all the things we have to assess when a patient is coming with the pain. So first one is location of pain. We have to identify where, we have to ask the patient like where you are having the pain, where is the area, site we have to check. So that is the first location of the pain. Next one is the intensity. Intensity means it will come like mild, it will come, moderate, it will come, and severe it will come. So in three types it will be. So we have to ask the patient like how much is your pain. So they will be telling like sometimes it will be mild, sometimes it will be moderate, or sometimes it will be severe. So they will address that how much, how the intensity of the pain. Next one is duration of the pain. So we have to ask that when the pain started and how long it lasted. So that is duration of the pain, how long the pain lasted. Next one is nature of pain. In nature of pain, it will come like some persons it will be sharp pain, dull pain, burning pain, or like a tingling sensation. So they will be telling all these types. So we have to tell them all these things, and we have to ask them which type of pain you are having. So we have to ask them nature of pain. So it will come like sharp, dull, burning, then tingling sensation it will come. So we have to ask them. Next one is factors relieving or worsening pain. So sometimes it will worsen the pain by time period, it will increase, or sometimes it will decrease. So we have to ask the patient like how it is reduced or increased. Next, it is pain scales. So first one is numeric rating scale. So it will come from 0 to 10. So patient rate the pain number. So we will just tell the patient to rate from 0 to 10, like 0 to 3, 3 to 4, 3 to 5, and 5 to 7, and 7 to 10. We have to address this to patient, and we have to ask them how much is your pain. So we can identify it is mild, moderate, or severe kind of pain. Next one is visual analog scale. So the patient mark in a level of pain. So it will come like a smiley form. So the smiley faces will be there. So we'll be asking to the patients which is your pain. So they will be address that, and they will be mark that pain level in that line. So next one is Wong-Baker faces scale. So this is usually used for children's. So children's means that can be addressed by the facial expressions. So we'll be showing so many facial expressions to the patients so they can identify which one is apt for them. So next is flap scale. So that is also used for infants. So these all are the pain scales which we will be using when we are addressing the pain or assessment of pain.
Next one is pain management. The pain management techniques are non-pharmacological method and pharmacological methods are there. First one is non-pharmacological methods. In non-pharmacological methods, we have to provide the proper positioning to the patient, and the massage therapy we can provide, hot and cold application, relaxation techniques, distraction methods. These are the methods we can provide to the patients for the pain management. Next one is pharmacological management. In medically, how we can manage the pain of the patient. First one is paracetamol. In the mild pain, we can provide the paracetamols to the patient. Next one is NSAIDs, non-steroid anti-inflammatory drugs. We can provide for the inflammation. Next, opioids like morphine for severe pain. The morphine like the medications we can provide in case of the severe pain. We can provide the opioids like morphines. Next one is adjuvant drugs as supportive therapy. For the supportive therapy, we can provide the adjuvant drugs to the patient. These are the non-pharmacological methods and pharmacological methods for the pain management.
So next one is TNNs and PCA. So first one is TENNs. What is TENNs? That is transcutaneous electrical nerve stimulation, and that means it is a small device that deliver mild electrical impulse and block the pain signal to the brain, used for chronic back pain, arthritis, and muscle pain. Non-invasive and safe method. So this is TENS, that is transcutaneous electrical nerve stimulation. So mainly this TENS, it's used for the pain, identifying the pain. So pain relief. So we'll be using this TENS for pain relief. So it will be mentioned that the blocks the pain signals to the brain and used for chronic back pain, arthritis, and muscle pain. So next one is PCA, that is patient controlled analgesia. That is also the pain medicine, pain control measure, pain relief measures. So that is patient self-administered pain medication using a pump. But from here we will be using a pump for the pain relief. Next one is this is commonly used after the surgery. So post-operatively we are using this PCA and provide immediate pain relief. and prevent the overdose through present limit. So after using this PCA, we'll be getting the sudden relief from the pain. So it is immediate pain relief and prevent the overdose through present limit. So it will not be providing overdose, it will be prevent the overdose. So these all are related to the PCA.
Next one is invasive techniques of the pain management and any other measures that we are going to study. First one is invasive techniques of the pain management. These methods are used when other treatments fail. When the other treatments are failed, that time we can provide that time we are used the invasive techniques of the pain management. First one is epidural analgesia. It is a type of injection in providing in the epidural space for the severe pain. For the severe pain, that time we can provide that time we are providing the injection in the epidural spaces. Next one, nerve blocks. Injection near nerves to block pain signals. For the blocking of the pain signals, we are providing the injection near to the nerves. Next one is intrathecal pump delivers medications directly into the spinal fluid. This medication we are providing, or this injection we are providing directly into the spinal fluids. Next one, surgical intervention used in severe chronic pain cases. In the severe or chronic pain cases, we are providing the surgical interventions. Next one, any other measures. Other measures of the pain management is proper positioning of the patient. For providing the proper positioning, that time we can reduce the pain for the patients. Next one is providing emotional support. Emotional support or psychological support we are providing. Next one is maintaining calm and quiet environment to the patients. The calm and quiet environment we are providing the patients to maintain or relieve the pain from the patient. Health education about the pain control. We are educate the patient how we can control the pain. Next one is regular pain assessment and documentation. We are assessing the pain and regularly document the severity of the pain in the patients.
Next is CAM, that is complementary and alternative healing modalities. So CAM therapies are used along with the medical treatment. So when we are using the medical treatment, along with that we are using the CAM therapies. So in CAM therapies, it will come like acupuncture, yoga, meditation, massage therapy, aromatherapy, herbal medicine. So these are the things which we'll be using in CAM therapies. So what is acupuncture? Acupuncture means insertion of fine needle to relieve the pain. So we will be inserting the needles into that point, so it will reduce the pain. So that is acupuncture. So we know that some points we will be inserting the needle. We will be fine needle insertion. So that is not thick, it is fine needle we will be inserting. So that from that it will be getting relief from the pain. So that is acupuncture. Yoga, we know that doing the yoga that improve the flexibility and reduces the stress. Most of them are doing the yoga, so it will improve the flexibility, it will relax our mind, we will get positive energy. So from the yoga we will get all those things. So next one is meditation. Meditation also same like the yoga, it will help in relaxation and mental peace. We will having, if any tensions or anything, any mental issues we are having, you can use this meditation or yoga, it will help in relaxation. So next one is massage therapy. So that also reduces the muscle tension. So if you are doing the massage therapy, it will help to reduce the muscle tension. So next one is aromatherapy. So that is a kind of oil for relaxation. So we can see that some kind of oil we'll be using to get the relaxation from that. So that is the use of essential oil, not the normal oil. It is an essential oils for relaxation. We'll be using aromatherapy. So next is herbal medicine. Herbal medicine is we know the natural medicines used for pain relief. So there will be natural medicines for pain relief. So that we are using as herbal medicines. So that is all about CAM.
Next chapter is Hospital Administration and Discharge. This is our 11th unit in Fundamentals of Nursing. The topics are, first one is admission to the patient unit and preparation of unit. In that we are studying admission bed, admission procedures, medical legal issues, role and responsibilities of the nurses when the time of the admission of the patient in the hospital. Next topic is discharge from the hospital. In that types we are studying planner discharge like LAMA and abscond referrals and transfer we are studying, discharge planning, discharge procedures, medical legal issues, role and responsibilities of the nurses, and care of the unit after the discharge. These are the topic we are studying under the hospital administration and discharge.
So in that, first we are dealing about hospital admission. So what is hospital admission? Admission is the process of accepting a patient into the hospital. So whenever the patient is coming to the hospital, we are accepting the patient. So that is that acceptance. So that is the acceptance of the patient into the hospital. It begins when the patient is registered and assigned a bed. So when the process is starting, first is admission. That means when the patient is coming to the hospital, the admission has started. So when the procedure has starting means it began when the patient is registered. So with their name, address, date of birth, everything when they are mentioning, and assigned a bed for the patient. So that time it begins, the process has started. So next is proper admission ensure a safe and organized patient care. So whenever the patient is admitted to the ward or area, so we'll be providing the safe and organized patient-centered care to the patient. Then only the admission process will be like covering up. So that is the definition of admission. So next it is coming like admission to the hospital unit and preparation of unit. So whenever the patient is coming, before the patient arrives, we have to prepare the bed and we have to make all the things as ready. So first is prepare clean and comfortable bed. So we have to maintain the cleanliness in the hospital. So whenever the patient is coming to the hospital, we have to provide clean and comfortable bed to the patient. Like whenever the patient is discharging from one area, so it's the responsibility to make the bed clean and appropriate. So then only next patient can come and visit the room. So that is prepare the clean and comfortable bed. Next one is ensure necessary equipment is available. So what all the equipment is necessary whenever the patient is coming to the hospital. So we have to make the reassurance that all the equipment is properly assigned in the room. So we have to ensure that necessary equipment is available in that room. Next one is maintain privacy with the screens or curtains. So it is very important that privacy, providing the privacy. So whenever the patient is coming to the ward or room, so we have to make sure that the curtains are there, windows are closed. So we have to provide the privacy to the patient. If the curtains are not working, means we have to ensure that to the senior authority that it's not working. So privacy is very important. Next is keep admission file and documents ready. So whenever before the patient is coming, we will get the call from the authority. So that time itself we have to make ready for all the files and documents, everything which all is necessary for the patients, because otherwise we are getting into that moment for all those things, means it will get the time delay for that. So we have to make all those things ready before doing the things. So next one is preparations help to reduce the patient anxiety. So whenever the patient is admitted to the hospital or coming to the hospital, we have to explain the procedure to the patients, what all the things we are doing to the patients and what all the things which they undergone after that. So we have to explain all those things to the patients. So then only they will get reduce their anxiety. So when we are going to the hospital, if no one is informing about anything, means we will get anxiety. So same things we have to do for the patients. So we have to explain all those things to the patients with proper details, without mug up any of the things, and we have to explain all those things to the patient. So these all are the things we have to keep in mind whenever the patient is coming to the hospital.
Next one, admission bed. Admission bed means usually an open bed. Admission bed means it is usually a open bed. Clean linen should be arranged properly. After the admission of the patient, the bed should be clean and it should be arranged in a proper manner. Bed should be comfortable and safe. Always the bed should be in a comfortable and safe for the patient. And so side rails must be checked. The side rails is functioning or not, is functioning properly or not. We have to check before the admission. Next is purposes. Purposes means to provide comfort and safety to the new patient. For providing a comfortable and a safety environment to the patients, we are providing the admission bed, and before that everything we have to check. Next, admission procedure. What are the admission procedures? Means welcome the patient politely, welcome the patient correctly in a correct manner, check doctor's admission order. Before the admission, check the admission order by the physician or the doctor. Verify patient identification details. All the identification details like what are the conditions, name of the patient, that should be checked in a proper and detail. We can identify the patient. Record vital signs. Record the vital signs, the temperature, pulse, respiration. Everything should be recorded in a proper Then collect health history, collect the health history of the patient, the condition of the patient, past history, present history, any surgical history is there or not, any surgery is happens or not, everything how to check. Orient patient to ward environment. It means orient the patient about the ward and about the environment of the patient. We have to educate the patient about the environment of the patient. Label patient belongings, and the proper documentation is very important. Everything should be documented in a proper way and proper manner. Everything, the patient's file, patient's belongings and everything is should be in a document properly. It is very important in the admission procedure.
So next it's coming like medical legal issues during the admission. So that means whenever it is a related to the complaint, like to the police we can complain. So that is medical legal issues. MLD we is calling like short form. So that is obtain the informed consent. So whenever the medical legal case occurs, so first we have to do is obtain the informed consent. So we have to get the consent from the person or the authority or the right person. Next is maintain confidentiality of patient information. So many of the persons will come and ask that what happened and what the things is going on. So we are not the persons to clarify all the persons like doubts. So we just need to maintain the confidentiality of the patient information. So we have to explain the things only to the right person or right authority. Next is proper documentation of injuries if medical legal cases, like if it's like any accident or anything is happened, we have to document the injury properly. Like documentation is very important. Like if after that we are looking into the documentation, so we have to do the documentation properly when we are doing anything. So documentation is very important. Next is inform the police in cases of accident or assault case. So this is what I had informed before. So we have to inform the police in case it's necessary, means we have to inform them. If any accident or assault cases, we have to inform the police. Next is follow the hospital policy strictly, because each and every hospitals they are having the different policies, different protocols. So wherever we are working, so we have to follow their policy, their protocols strictly without mismatching anything with others. So we have to follow the hospital policy strictly. Next is legal safety protect both patients and the hospital. So we have to maintain the legal safety protocol so that it will help both the patients and the hospital members itself. So this is the things which we have to look when the medical legal cases are occur. So next one is roles and responsibility of nurses. So what are the roles and responsibilities of a nurse when the admission has occurred? So first and most important things, we have to provide the psychological support to the patients. So we can reassure the patients, we can provide the comfortable words to the patient so that the patient may feel little bit reduce the stress. It will help to reduce the stress of the patient. So provide psychological support to the patient. Next one is assess physical and mental condition. So that is the assessment, like A to E assessment we have to done, like proper assessment we have to check. So it will come the physical assessment, along with that it will come the mental assessment. We have to check the orientation, alertness and the consciousness of the patient. So these are all the things we have to check. Along with that we have to check the vitals of the patients, pain level of the patient. So these all the things we have to check. So the assessment is very important. Next is record the baseline data. So what all the data it's there, so we have to record the baseline data. If there's any if the patient's temperature is high or if in the patient's pain is high, so we have to mention that properly. So record the baseline data properly. Next one is ensure the patient safety. So here it will come the privacy also. So we have to provide the safety of the patient. So we have to educate them what are the things they can do and to whom we will be informing if anything happen, and providing the proper privacy to the patient, safety of the patient we have to maintain. So these are all the things which we have to look. Next one is to educate the patient about hospital rules. Whenever the patient is coming to the hospital with admissions, we have to educate the patients with all the things like hospital rules, protocols, policy. There will be like sometimes the patient will have that urge to smoke in the hospital. So we have to explain to that patient that it's not allowed in the hospital to smoke. So it will affect the other patients, other members, other hospital members. So we have to educate the like things to the patients properly. Then only they can understand the things, because they will be not aware of the things which will be policies, protocols of the hospital. So it's our duty to help the patients to educate all those things. Next one is maintain accurate documentation. So we already informed that we have to do the proper documentation regarding the patient. Next one is nurse act as caregiver and advocate. In some cases we have to work as an advocate for the patient, so we have to stand with the patients. If the patient is having any doubt, anything like any issues they are having, we have to stay as an advocate for the patient, and we have to take care of the patient. We have to provide care to the patient as a caregiver, and we have to speak for the patient in some cases. So these are the roles and responsibilities of the nurse when the admission has occurred.
Next one, discharge from the hospital. What are the things we have to do while the discharge of the patient from the hospital? Discharge is the process of releasing a patient from the hospital care. After the hospital care, we are releasing a patient from the hospital. This means discharge. It occurs when treatment is completed or transferred. It will be occur at the completeness of the treatment. At the end of the treatment, we have discharged the patient from the hospital. Next one is the types of discharge. The types of discharge, first one is planned discharge. It means patient leaves after treatment completion. After the treatment completion only patient will leave the hospital, that is planned discharge. Next one is LAMA. LAMA means leave against medical advice. Patient leaves without doctor's approval. Without the doctor's approval, the patient will be discharged from the hospital. It means LAMA, leave against medical advice. For the multiple choice questions, it will be asking what is LAMA. Next one, abscond. Abscond means patient leaves hospital without informing the staff. Without informing the staff, without the approval of the doctors, the patient leaves the hospital. It is abscond. Next one is referral. Referral means patient sent to another hospital or advanced care. For the advanced care, for the more care, the patient is referred or patient is referred to the other hospital or other specialty hospital. It is referral. So transfer. Transfer means patient shifted to another department or unit, or another from the ward the patient is shifted to the ICU. Like that, the patient is shifted from another department or unit. It is a transfer discharge.
So next is coming like discharge planning and discharge procedure. So what are the discharge planning? So first, whenever the patient is getting for discharge, what are the plan we have to do? So that is discharge planning. So first it is start from day of admission. So we have to start from the day of admission. When the patient has admitted to the hospital, from there we have to start. What are the things we have done from start of admission we have to start. Then next one is assess the patient's home condition. So how the patient will be looking after when the patient reaches the home. So that is the assess the patient's home condition. So sometimes the patients may not have any persons in the home to look after them. So we have to make sure someone will be there, or if no one is there means we have to arrange some home care services or home care nurses to the patient if it is necessary. So we have to look home condition of the patients and the environment of the patient, like if there is any slippery environment will be there, so if the patient is safe in the home. So these are the things we have to look when the patient is getting discharged. Next is plan follow-up visit. So after the discharge, most of the patient, usually all the patients will be having the follow-up, like how the process is going on, how the patient condition get improved. So for looking into that, they will be provided a follow-up. So the follow-up plan we have to explain to the patients, and we have to look into that. When the it will be, sometimes it will be after 15 days or 1 week, after 2 weeks. So they will provide, the doctors will provide like follow-up visit. So we have to mention that, we have to explain to the patient regarding the follow-up visit. So next one is teach medication and diet instructions. So after the discharge, the patients are having the medication to take when they have reached the home. So without informing them, they can't take the medication properly, like right dose will be there, right time, right route, everything we have to explain to the patient. So whenever the patient is getting discharged from the hospital, we have to educate them when the medication has to take. Sometimes it will be before food, sometimes it will be after the food. So we have to explain to the patients when we have to take the medication and what time we have to take the medications, how the dose we have to explain to the patient, the frequency we have to explain to the patient. So these all are the things which it is come under the medications, and the diet instruction will be there. Sometimes the patient is having like they can't able to take the salty food, they can't able to take the sugary food. So we have to introduce them that what are the diet which they can look. Otherwise we can mention like dietitians to look after to them, and dietitians to explain the procedures to the patients, what all the diet they can take. So these are the things which we have to explain to the patients regarding the diet and medication. Next one is arrange community support if needed. Like if it is necessary means we can provide the community support to the patients, like healthcare workers will be like asha workers will be there, so we can provide these all the things which is necessary to the patient. Next one is good planning prevent the readmission. So whenever the patient is getting discharged, so we have to provide a proper planning to the patient, so that it will help to avoid the readmission to the hospital. If the patient is taking proper medication at the proper time, so it will help the patient to improve their condition. So these all are the things which we have to explain to the patient. We have to tell the patient that what all the things they can do, what all the things they can't do, because some surgery patient, after the surgery, if they are going back to home means they can't able to take the overweight, so we have to explain these things to the patient. So when they are looking all those things correctly, if they are following all this instruction properly, they can avoid the readmission to the hospital. So these are the discharge planning which comes under when the patient is getting discharged. So next one is discharge procedure. So discharge procedure, it will come like, first the doctor write the discharge order. So who is going to discharge a patient means the doctor has the first right to get the discharge of the patient. So doctor want to write the discharge order. Next is prepare the discharge summary. So discharge summary, the authority will be there to write the discharge summary. So doctor also along with them to get that instructions and data everything, so that they will provide the discharge summary to the patient. And next one is explain medication and instructions. So we have already explained that how we have to explain the medication, how we have to explain the instruction to the patient. Sometimes nurse need to explain these things to the patient. Sometimes the hospital has separate members to explain this discharge process to the patient. So we have to look into that, and if no one is there means we we have to explain these things to the patient. Next one is return patient belonging. When the patient is going for surgery or any procedure, we will be taking that patient, we will be telling that to keep it away from the hospital. So we have to give it back to the patient if anything we had taken from the patient, like any belongings, anything. So next one is remove the IV line and catheters if ordered. So whenever the patient is getting discharged, what we have to do is we have to remove all the lines, like IV lines will be there, catheters will be there, central line will be there. So if it necessary means we have to remove all those lines if the doctor is prescribed, because sometimes the patients need to take all those IV lines and IV medications from the hospital, from the home, so that we are not able to remove the IV lines. So if the doctor is mentioning to remove that IV and catheter, so we can able to remove all those things. Next one is complete the billing formalities. After removing all those things, we can tell the family members to complete the billing formalities, then only the process will end. And last, it is like ensure the patient understand home care instructions. So we already explained that home care instructions. So what are the things we have to do when after reaching the home. So these are all the instructions we have to provide to the patients whenever the discharge has ready and discharge summary has ready.
Next is medical legal issues during discharge time. During the discharge time, what are the medical legal issues are occurring? Obtaining signature for the discharge. We have to obtain the discharge. In the discharge summary, we have to obtain the signature from the authority or the doctors. From the LAMA cases or leave against medical advice, in that cases, get written consent from the patient. Or if the patient is minor, we have to get the consent from the family members or parents. In proper documentation in records, and everything is recorded in the patient's record, everything is document. Maintain patient confidentiality. Documentation protects hospital legally. If the proper documentation is there, it will help the hospital legally. Next, the role and responsibilities of nurses in the discharge time. What are the roles and responsibilities of the nurses? Provide health education. Provide a proper health education to the patients about the medications, about the exercises and the diet planning. Everything we have to educate the patient and the patient family members also. Demonstrate wound care if needed. If any wound is there or any surgery is occurring in the surgical side, how we can provide the how we can manage the infection. Everything would be demonstrated to the patient. Explain diet and medication schedule. The medication schedules and diet planning, everything should be explained to the patient and the family members. Encourage follow-up visit. Any follow-up visit, any visit is advised by the doctor. Encourage the patient to do the follow-up visit. Provide emotional support, provide the patient the psychological and emotional support to the patient for the safety of, feel the patient is safe. Then the next one is nurse ensure continuity of care, provide the continuity of care to the patient. These are the roles and responsibilities of the nurses while discharging the patient.
So next is coming like care of unit after the discharge. So once the patient is discharged from the hospital, what are the care we are doing to the unit? That is the care of unit after discharge. So first is remove the used linen. So when the patient is admitted to the hospital or when the patient is admitted to the separate bed, so after discharging the patient, we have the right to remove the used linen. So otherwise another patient will come and use the same linen. So we need to remove the used linen. Second one is clean and disinfect bed and surrounding. So we have to clean the room by proper disinfectant methods, and the surrounding also we have to clean. And if in case of isolation, if it's happened, means we have to fumigate the room in such cases. So we have to look into that if the patient is isolated patients or normal patients. Normal patient means we have to clean and disinfect the bed and the surrounding area. If the isolated patient means we have to fumigate the room, and after that only the another patient can enter that room. Next one is send the equipments for sterilization. All the equipments which is used for the previous patient, we have to send all this equipment to the sterilizations. After that only we can use for the next patient. Next is prepare the bed for next patient. So we have to arrange the bed, that is bed making. All of the nurses is known that bed making. So we have to prepare the bed, and for the next patients with proper methods we have to use the bed making. Next one is complete the documentation. What are the documentation we have to do? We have to complete that documentation. So next is maintain infection control and readiness. So we, after getting all these infections, waste and all, we have to discard it properly in proper. All the waste are separate waste containers. So we have to discard all those things properly. Like sharp containers should be in white, and that blood or the blood stains and the yellow, it will be in the yellow cover. So we have to make sure that we are doing it properly. So that is infection control and readiness. We have to maintain the infection protocols and procedures whenever we are following a policies or protocols from the hospital. We have to maintain that infection control policies. Yeah. Next is, so the portion has end. So if any doubt, anything means you can just ask. ആർക്കെങ്കിലും എന്തെങ്കിലും ഡൗട്ട് അങ്ങനെ ഉണ്ടെങ്കിൽ കമൻറ്റ് സെക്ഷനിൽ ചോദിക്കാവുന്നതാണിപ്പോൾ. So doubts and കാര്യങ്ങളൊന്നും ഇല്ലാന്ന് തോന്നുന്നു. So we are going to wind up the class.